Anti-aging facelift dentistry for seniors. There is hope for seniors like there's never been before. We can reverse the impact of aging at the source, which is your jawline, your bite. Your teeth are wearing down, you got the sinking jawline, very typical of the aging face. We're going to give you something you can't get with most other methods, or in fact any other method that I know of. And so here is the atypical aging face. He has deep wrinkles, his chin is too close to his nose, his lips are squeezed together. This is very typical. And when he's chewing and he's eating, you can't hide this. His face, the shape of his face is short and round like an older person versus younger people. The shape of your face is more like an egg. And so women have the same exact problem, lips too close together, jaw, soft tissue starting to buckle. You can stretch your face out and get a facelift. It does not improve the shape of your face and from structurally. Facelift dentistry is healthcare. We're going to make your health better. We're going to help you feel better. We're going to give you a look that you can't get with a facelift. That's why we call it Facelift Dentistry. None of her healthy teeth are drilled down. You don't need any shots up here. We're not going to cut these teeth down. We may replace a crown or two because you can see the crowns that she has in the back. But basically, this is a non-invasive mechanical solution for a mechanical problem. We have a mechanical problem, which is our teeth are worn down too short. That's the problem with what most of us are experiencing. And so when you see a face like this and lips squeezed together, you know it's time to get a face like that. Would you rather look at this face or would you rather look at this face? We took 10 or 15 years off of her face by giving her health care, by improving her bite, her airway. She sleeps better, she breathes better, she's out of pain. She's one of those patients that just couldn't get any help whatsoever. And neurologists thought it was nerve pain and everybody thought it was this. It was a mechanical problem. Basically, her jaw and her two jaw joints were not working together. Her teeth were fighting her jaw joints. Every time she closes, her jaw is in a bad position for her joints. The idea of facelift dentistry is to get your jaw in the position to work harmoniously with your jaw joints. It is trauma reducing, it is stress reducing. And so the bite with a deep overbite, she now has teeth like this. Her jaw has come down and moved forward. She's more comfortable. This is maximum health care with incredible cosmetic benefits. Here is a side view so you can see how much of an overbite she has. Overbite is gone. And she has a bite like this, and she went to a bite like that. This is facelift dentistry. It changes your jawline, supports your face from inside, gives you more room for your tongue, speaking, sleeping, and it all starts with the jaw track, jaw position. We test you first. You're not going to guess. We're not going to guess and do jaw surgery and, oh, well, maybe that will work. Or we're going to stretch your face. Do you like that? No, we're not doing anything like that. She's going to show you the jaw track jaw appliance, and what it is an appliance that snaps in, that I designed, and I do it in coordination with jaw imaging so I can see inside your head what you're doing, and I can look at that and know whether you're in the right position or at least close to the right position or not. We can see what we're doing. You, the patient, get to feel what you're doing. And so when you look at the proportionality of her face, she knew when she's wearing jaw track, she knew she was going to come out better because her lips and her jawline and everything are in the right position. Then, once we know what your jaw position is, we build your teeth to fit that position. This is the facelift dentistry method. We use thin layer of porcelain over your healthy teeth, and if you have good crowns, we build that same thin layer over your regular teeth, and so when your jaw comes together, you're in your new jaw position. Basically, here she is. She's going to explain to you the pain she was in, and she's going to show you the jaw track jaw position and how that helped her. It's good to hear the patient say it for herself.
I have a deep overbite. I also have uneven teeth. They look like a bit of a roller coaster. I have jaw problems. My ears hurt, my neck hurt. I just hurt all on my left side. And that's been for like 20 plus years. This is jaw track, and this is the first time that I've ever had this little procedure or gotten this little appliance. And this is my bite with jaw track. I never know where to position my teeth when I don't have the appliance, and I'm just tapping all the time, and I've ground my teeth down a whole lot. So with this, it feels more evened out. It just makes me feel a little more stable.
The beauty of this is when you wear jaw track, you know whether you feel better or not. You can see the shape to your face. You can see your new profile with jaw track in. And I can adjust that. I can tune that to you because of the jaw imaging. I can see where your jaw is, and I know whether we can go more or not. This is a beautiful, scientific, proven method that works incredibly well. It's highly predictable because there's no surgery. We're not going to drill down your teeth. We're not going to cut them down to little pegs. We're building porcelain over your teeth called Venlay restorations. And so here's a gentleman with the same problem. You saw this earlier where his chin's too close to his nose. And so here he is after, where he now has a masculine jawline, a younger shape to his face. He's speaking better, breathing better, he's happy. This is a game changer. You go from this smile to this smile. This changes who you are, what you are, how you feel about yourself. This is a mental booster, a self-esteem booster. The cost is about $80,000. This is not inexpensive dentistry because all of your teeth are treated all at one time. You know, dentistry is, oh, let's do 6 porcelain veneers. That's patchwork. Crown here, crown there, 3 crowns here, whatever. It's just patchwork dentistry. You have the same face and you have the same jawline when you're done. Facelift Dentistry changes your jawline, changes your face, improves your health. It does things the others don't do, and it's done by doing them all.
Getting my teeth repaired was a long one, a long journey. I tried some other dentists, and I tried some people that said they could give me cosmetic dentistry. But when they really came to looking at my mouth and looking at my teeth, my problems, they simply said they couldn't really do anything. And after a long search, I found Dr. Muslin, and I'm super happy. Everything is working well. I can speak better. My overbite, which was horrendous, is correcting itself wonderfully with these new teeth, and I'm feeling so much better about it. I don't have the jaw pain I used to have. I sleep better, and I'm really happy I did this.
Think about it. This is a revolutionary method. It's not painful. It's not destructive. It's not invasive. It's very low risk, and it gives you something that is so far beyond porcelain veneers and cosmetic dentistry. And he saw specialist after specialist, which is why he flew in from another country. Why did that woman fly in from another state? It's because they don't have it in Texas, or they don't have it in Bermuda, or wherever everybody is. The point is it's worth flying in to save your teeth. So just call the office. Talk to my staff. They're smart. They've been with me for years. They get it. And you can also get our cell phone number, and you can text us a short video of yourself. You can send us some pictures of your x-rays that were taken at your dental office, maybe some pictures of you. This works incredibly well. Let's not try to experiment with other methods, because I've already done that. I've tried everything as a dentist. I didn't like the invasiveness of dentistry. I didn't like the shots, the drilling, all of it is unnecessary in my point. My name is Dr. Sam Muslin. I'm a master of the Academy of General Dentistry, and I've been awarded by the International College of Dentists. My faceliftdentistry.com website has more finished cases with before and after video than any website I've ever seen anywhere in the world. Let's get started.